Hi, I'm Ed. I'm a patient in Airedale. The NHS is changing now faster than at any time since it was founded. I've been a volunteer in the healthcare sector in Keighley for 5 or 6 years now, and what's become clear to me is that communication and information is very important in people getting the best they can from healthcare. Roles within the healthcare are changing, and some new roles are being developed. In order for you and your family to get the best out of this, we've made a couple of videos to explain some of these changes.
eConsult is the leading online platform for patients to consult with doctors without having the need to come into the surgery. So you can use it online 24/7. What this now means is that you no longer have to get in the queue at 8 a.m. or 8:30 a.m. when the practice phone line's open. You can go online and actually tell the doctors why you want help, putting it in your own words. By going to your GP practice website, we'll have a nice banner on there. Simply click that banner and you'll be in the portal ready to consult with the doctor. It's designed so that patients can go on there, simply fill in yes/no answers. They're the questions that are designed that if you were sat in front of a doctor, they would ask you the same questions, but the answers are designed for yes or no, therefore giving the doctor a really good idea of what's wrong and how much help you need. Once they've completed an eConsult, they get a message back from the portal saying that's gone into the GP practice. Some practices will get back to you within 2 hours, 3 hours, and they'll make that clear on the website when you submit the eConsult. The latest you can expect a response from your practice is by 6:30 p.m. at the end of the next working day. The most popular conditions dealt with by eConsult are general advice, cold and flu type symptoms, coughs, back pain and depression, and you can access these by going on your GP practice website and finding a specific template. Patients often say there's quite a few questions to complete when they're going to eConsult. The reason for that is that we want to get as much history from the patient as possible so the GP or clinician can make a well-informed decision on what the best appropriate action is for that patient. On average, it can take between 5 to 10 minutes at first to submit an eConsult. That is getting familiar with the website, the form, some of the boxes to enter data. But the more often you submit a query, the quicker it becomes. And often patients say they can now get down to between 3 and 5 minutes. The best way to use eConsult can be either from a mobile phone, computer, laptop or tablet device. This can be at home or in the office, anywhere private that you're happy to fill it in. Some patients ask, can I get help to set this up? The best place to go is go into your GP surgery, speak to the reception or manager, and there'll be somebody available normally to take you through this. Often there could be a PPG group member there as well that can guide you through what to do. You don't have to register a username or password to use eConsult. You simply have to be registered at that practice to go on, and you simply enter your name, your address at the end of the form and submit that to the practice. So the platform is available 24/7. Although practices get back to you between 8 and 6:30 p.m, you can go on at any time of the day to submit a query. eConsult is not a barrier to face-to-face contact with GPs. All it does is it allows the GP and clinicians, nurses, practice staff to make the best decision on what is the best outcome for you. If you need to be seen, you will be seen. If you submit an eConsult query, one of the one-way messages back to a patient could be, "Hi Dylan, thank you for submitting your eConsult. I've booked you a face-to-face appointment with Dr. Smith at 3:30 p.m. today." For children, you need a parent or guardian to go on there and submit that, but to use the actual portal itself, you must be 18 and over. So if a patient is unsure how to fully explain their symptoms or maybe best describe what is wrong with them, what we would say is for them maybe to have a carer, friend or family member there with them who can ask the questions to them and help them complete that on behalf of that patient. It's often asked if online consultations are the future of general practice. I wouldn't say it's the future of general practice is in that everybody will be doing this. It's certainly part of the answer to the workload crisis that we have in general practice these days, and it's certainly there as a route for patients that no longer need to go and see a doctor face to face or want to walk down to the surgery. They can simply go online, consult a doctor, get the appropriate advice for them. When you look at everyday life today, we're booking holidays, we're doing banking, we're doing FaceTime and communicating with people all online. Healthcare needs to catch up with the modern day world, and this is just really accelerating that catch up where we can actually get used to going online and accessing healthcare appropriately when we need to. At the point of use, eConsult is free for the patient. It would normally be funded through the NHS streams. Patients do not pay for this. It is part of their GP service.